remains a serious public health issue, they require continuous awareness and community participation. As part of my community service, cost under value-based education, I carry out project titled Hybrid Dengue Awareness Campaign at Taman Velok Sarawak. Hi, I'm Azlina, and in this video I will share the implementation activities and outcome of this project. With the support of my two family members, we conduct the awareness activity, environmental monitoring, and share educational materials through both face-to-face and online platforms. The main goal of this campaign was to increase community awareness, dengue prevention, and encourage everyone to help maintain a clean and healthy environment. Many people understand the importance of dengue prevention, yet simple practices such as checking for stagnant water or maintaining a clean environment are not always carried out regularly. As a result, mosquito breeding can continue, increasing the risk of dengue transmission. For this reason, the project was guided by the value-based education principles of responsibility and civic-mindedness. Responsibility was demonstrated by encouraging individuals to take ownership of reducing dengue risk within their own surroundings. Civic-mindedness was promoted by emphasizing that protecting public health is shared responsibility where every member of the community has a role in supporting a cleaner, safer, and healthier environment. The term hybrid in this campaign referred to the combination of digital and physical approaches used to spread dengue awareness. The digital approach involved sharing awareness material through online platforms, while the physical approach involved direct engagement with residents through house-to-house visits. The first stage of a campaign involved preparing the dengue awareness materials. As a project coordinator and awareness presenter, I was responsible for developing the campaign content and coordinating the implementation activities. I designed a dengue awareness brochure using Canva as the main educational materials for the campaign. The brochure included information about the meaning of dengue, signs and symptoms, prevention methods, possible mosquito breeding areas, and a reminder encouraging the community to work together in preventing dengue. Completing the brochure, the digital awareness activity was conducted by sharing the dengue awareness material through WhatsApp contact and WhatsApp groups. To evaluate participant responses toward the campaign, I prepared a Google Form survey entitled Dengue Awareness Campaign Evaluation Survey. The survey link was shared together with the awareness material to WhatsApp platforms. The survey was designed to collect feedback regarding participant dengue awareness, preventive practices, challenges in dengue prevention, and their opinion on improving dengue control efforts. The second stage involved physical community engagement through house-to-house visit within the neighborhood. Using the printed brochure as a reference, I share information regarding dengue prevention and encourage residents to practice suitable preventive action with their homes. With residents' permission, my third team member, who serves as an environmental monitoring and activity support coordinator, conduct observation around their homes to identify possible mosquito breeding risks such as stagnant water or water holding items. When potential risks were identified, the third team member explained the concern to residents and encouraged appropriate action to reduce the risk. Throughout the campaign, my second team member, who served as the documentation coordinator, was responsible for capturing photographs and videos as evidence of the activities. The cooperation between all team members ensured that digital awareness activity and physical community engagement were carried out in an organized and systematic manner. The hybrid dengue awareness campaign, the value of responsibility, teamwork, and civic-mindedness were demonstrated to the way I responded to the residents, handled challenges, and worked with my team. Responsibility. Responsibility was demonstrated when engaging with residents who had different challenges in practicing dengue prevention. During one household interaction, a working parent explained that their busy schedule and long working hours made it difficult to consistently check potential mosquito breeding areas. Instead of assuming that the resident lacked concern, I recognized their situation and focused on suggesting realistic actions such as setting aside a short period each week for household inspection. These experiences show the importance of providing health guidance that considers people's daily circumstances. Teamwork. Teamwork was reflected through the coordination between team members throughout the campaign. Each member contributed according to the assigned responsibility, including awareness delivery, survey evaluation, and environmental observation support. The cooperation between members allowed the campaign activities to be completed systematically and ensure the different aspects of the project were properly managed. Civic-mindedness. Civic-mindedness was demonstrated through the way we continue supporting the community despite facing different reactions from residents. During one household visit, some residents were elected or uninterested in engaging with us. Instead of viewing their response negatively, I respect their decision and maintain professionalism while continuing to provide awareness to residents who were willing to participate. This experience shows that serving the community requires patience, respect, and understanding of different perspectives. Through this experience, I learned that community service is not only about the delivering information, but also about understanding people, adapting communication, and working together to create meaningful engagement with the community. The hybrid dengue awareness campaign achieved outcomes through both difficult awareness and physical community engagement. For the digital awareness outcomes, participants provided feedback after engaging with the awareness materials. The response showed that information share was useful and successfully increased participant exposure toward dengue prevention messages. The survey findings further support the outcomes by showing participant understanding and attitude show toward dengue prevention. The highest response showed that 100% of participants recognize stagnant water and rubbish accumulation as important dengue risk factors, indicating their awareness of environmental conditions that contribute to mosquito breeding. In addition, 60% of participation were motivated by learning practical methods to check their homes, showing that they value prevention guidance that could be applied in daily routines. The survey also showed that 65% of respondents conduct household inspection weekly, reflecting awareness toward regular preventive practices. For the physical awareness outcomes, the household engagement helped residents to gain a clearer understanding of dengue risk within their own surroundings. Video presented as evidence further shows that information provided was useful and strengthened residents' understanding of dengue prevention practices.
Yes, I have read through this flyer. Let's prevent dengue together, and all the pointers. And I find it the prevention measures shown in this brochure are effective and aligned to our Malaysia standard public health recommendation preventing the dengue. And I would rate this as 9/10 for this particular student that has covered all the KPI that's needed.
In conclusion, the Hybrid Dengue Awareness Campaign highlighted the application of healthcare knowledge through effective communication and community engagement. The initiative improved dengue awareness and encouraged preventive actions among participants and residents. The project reflects value of responsibility, teamwork, and civic-mindedness through providing accurate information, cooperation effectively, and supporting community well-being. This experience strengthened my communication skill and reinforced my understanding that effective healthcare requires both knowledge and consideration of people's needs. Thank you.